We move on to blood clotting disorders. The first that we're going to look at is thrombophilia. Thrombophilia is basically a condition where the blood clots too easily, and that can be a major issue in pregnancy. Why? Because you will have these tiny blood clots that can form in the very small vessels of the placenta, and a good and healthy placenta that allows the free flow of nutrient-rich blood is absolutely essential for the development of the embryo. If these tiny blood cells within the developing placenta, or major blood cells for that matter, the placenta, do not remain patent and open, it will be difficult for the embryo that has finally managed to implant itself to develop adequately. Therefore, thrombophilia can lead to early pregnancy loss, miscarriages. When we talk about blood clotting disorders that affect pregnancy, it will be almost impossible not to mention antiphospholipid syndrome. Why? It's because antiphospholipid syndrome, also known as APS, is one of the most common cause of early pregnancy loss and IVF failures. It's because APS is one of the most common autoimmune blood clotting disorders linked to early pregnancy loss and IVF cycle failures. So how does APS lead to IVF cycle failure? Well, first of all, you get tiny blood clots forming along the endometrial lining. These tiny blood clots will then disrupt the blood flow to the implanting embryo. And of course, these multiple tiny blood clots that will form along the endometrial lining will lead to inflammation along the endometrium itself. Can you find out if you have APS before you go for your next IVF cycle? Absolutely.